Welcome to the GoOutLiving Attitude, a cancer survivor's journey through health and wellness, helping others search for the tools to bring us a healthier and happier lifestyle. Hi everyone, Jonathan Brandt, GoOutLiving. Today we have a special guest. We have Dr. Aimee Duffy, physician, lifestyle coach, mentor, best-selling author of Normal Doesn't Have Side Effects and Why Can't She See Me? Welcome to the show.
Thank you. Thank you for having me.
I'm excited. Just reading through everything, your bio, and just knowing, all the shows you've been on and just how many people you're really trying to reach it's just amazing to me that we're able to have people like you out there. And I really appreciate you being here. I thought we would start with, how did you get into functional medicine? Because that
Yeah,
was a little bit of a step for you as well, wasn't it?
it was, and I am eternally grateful that it happened fairly early in my career. So I could jump on the bandwagon, if you want to call it. Now it's been 20 years, but so it goes way back. When I was little, I just absolutely loved babies. I wanted to hold all the babies and play with babies, and so I got to be a babysitter when I was 11 years old. I started babysitting, and I really was like a mother's helper because I wasn't old enough to really stay at home alone myself, let alone take care of babies. But so I started with this family, and then that family grew, and then her sister was part of this, and she had kids, and so I babysat for, it was like a family affair. So when I was a senior in high school, I had the opportunity to be in the delivery room when they were having another baby, and that was really my first experience in the medical world to some degree. Like I kind of knew that I wanted to be a doctor, or thought I did, but I didn't really know exactly what it meant or what I wanted to do. And I grew up in Boulder, Colorado, so there was a lot of, I call it granola woohoo stuff. So I thought maybe I was going to be a midwife or, do something like that. And so just having that opportunity to be in the delivery room started me on this path of, okay, I want to deliver babies. And so I went to college, I went to medical school, thought I was going to do OBGYN. Then for a while, I had my own baby in third year of medical school. So then I thought I'll do emergency medicine so I can just work shifts and I could be home. And then that was stressful, and really just not my place and my passion. And I ended up in family practice where you could really do both. So there were rural family residency programs that did OB. And then, the beauty of that was that you got to do the pediatric part of it as well, and sort of grew from there. So I did my residency here in South Carolina in a very small hospital. There were only 2 residents per year, so we got to do everything. And by the time I finished that, I had C-section privileges. I was delivering thousands of babies at that point. And so I was connected to the OBGYN office that was right next door to ours. And they offered me a position to come do OB and kind of women's health, primary care. A lot of OBGYN or women go to their OB for primary care too, really. So it was kind of a good connection there. And that was really my introduction to more women's health, because in family practice, we do a little bit, and we were taught about, some birth control choices, and we could do regular pap smears and things like that, but we really didn't dive into hormone replacement very well. And so, being in an OBGYN office, like, that was front and center of my conversations with a lot of patients. And that was around the time, it was just shortly after this women's health initiative came out, where there was this big scare about all the negative effects that hormone replacement was seen, particularly with the study was done by Premarin and Prempro, which were not, necessarily traditional hormone replacement. And so it kind of got this big umbrella of hormones are bad, and we should only use them in short periods of time for, as low doses as possible. And that just didn't sit well with me. I'm like, okay, we have all these negative things, but yet we're still recommending it, but we're putting a limit on it. And then it's like, how do we know, is that okay to use or not okay to use? And it just was not, it just didn't sit well with me. So I started kind of doing more research, and it was just on my radar. And I happened upon a conference in 2008 that was natural hormone balancing. So that was kind of the first experience I had in sort of bioidentical hormone replacement, more natural hormones. And it also went into adrenal health and thyroid health, and sort of all these things that we dig into with functional or integrative medicine. So I had this like what I call the tiny little window kind of Alice in Wonderland experience where then I ended up in this world of like, oh, like we could do different things. And so that's really where I started is doing saliva test hormones on women, prescribing compounded individualized hormone replacement for them, really addressing adrenal health, which was huge. We were not really taught anything about that, and just as the years went by, I did that for about 4 or 5 years in that practice. And then that practice, like a lot of practices, got bought out by the hospital system. I knew I didn't want to go that direction. So I took a big plunge and decided to open my own practice. Had no idea what I was doing, but I had some help at the time. Um, and so, that started Carolina Integrative Medicine 15 years ago. And here we are now, just, going from hormones and adrenals to now we understand that the gut is such a huge part of that. The immune system, nutritional deficiencies play a role, stress on our bodies, all these things that incorporate the whole really big picture. So that's kind of where I started and where we are today.
There's so many places I can go with that. Um, as we continue on, would I say there's like this Western medicine versus holistic or functional or alternative. Are you seeing that we're trying to work together, or is it still very separate to you?
Um, what's interesting is I think the idea of functional, integrative, holistic, whatever you want to call it, is growing. I speak at conferences. There's a huge conference called A4M, which is like the advancement of anti-aging medicine, but it's all about this kind of functional health stuff and hormones. And, they grew from a couple of hundred attendees, 20 years ago to 1,000. I mean, I think there was like 7,000 people at this event in December in Las Vegas. So that is growing, but I feel like it's almost like this is growing and this is growing, but there's a huge space in between that still is very there's not a whole lot of gray area in there. It's kind of like you either go this way or you go that way. Not only, I mean, patients are seeing that, which can be confusing. Insurance, is really keeping it very separate. And one of our passions is it's not only talking about what we're doing here in terms of for patients to hear, but we really want to teach other practitioners that there's a different way of doing this. And obviously they have to show up at one of these events that we teach to, but how can we get out, get the word out there? And most of the practitioners that are learning this stuff are because they're going through something of their own, or they have a patient who experienced it and they had an awareness and they go, oh, I want to go learn more about that, and then their eyes are open to it. So unfortunately, I think it's still pretty separate.
Well, and the reason I brought it up, for me, my wife, we both went through cancer. And you're almost scared into, okay, this is your only path.
Right.
And I get cancer is probably a little different. It's, as far as we know, chemo, radiation, those are just the standards. But we don't talk about the side effect part of it. And I think that's where the holistic or the functional can really help too. And that's why I
Absolutely.
think, if we could get into having that discussion and getting everybody on the same page, but maybe you could discuss kind of the side effects that we're starting to see a lot more of from the medications that we're taking.
Well, and what's a little bit tricky too is that I mean, I'm not an expert in this by any means, but I'm aware enough to see that the medications that are being used are new and improved, right? There's always the newest thing out there that's going to address, and some of it to some degree is improved in that it's a little bit more direct. They're able to sort of test the tumor cells and then be able to direct the treatment there. But yeah, it's still attacking your own body to some degree, right? A lot of these things are turning off the life cycle of a cell, if you want to call it, the metabolism of the cell, or depleting it of nutrients so that it kills off the cancer cells, but then it's depleting your own cells as well. So I don't think they've quite been able to figure out targeting the bad guys and not addressing the good ones. And again, this is not my area of expertise, but I have seen where, like, MD Anderson at Houston talks about having sort of some holistic type approach and that sort of thing, but it's very minimal compared to what what we can really do. And I think the side effects go to what it's actually doing to your own cells, right? And so not only is it killing the cancer, but it's damaging your own body, and at some points it can increase inflammation even more, or it can the metabolism. A lot of our own body stress comes from exposure to chemicals that our body is not necessarily used to, and there's probably some genetic component, right? So there's like two things that happen: is this gene is already sort of a little bit off, and then it gets this exposure to chemicals in our environment, and then maybe an illness or something like that, and then it sort of all things come together to create cancer. And so we're over there trying to figure out, how do we turn this off? And you can't really turn your genes on and off with a medication per se. So they're trying to do things that deprive the cell of life so that it dies, right? And if you're doing that, then you're doing that to all. They can't figure out how to target only the bad cells and not the good cells. So if we're doing that, then you've seen it all. I'm sure in your experience, but people that are going through chemo, their immune systems are very fragile because they have no immune system, because that's what it's trying to break down. And so the risk of getting sick, the risk of again, just more exposure to other infections. And then you need a medication that helps you, manage that. And then, I think we see a ton of nutritional deficiencies, and again, inflammation. I see a lot where you're given steroids to get put, to go through chemo. And I've heard a lot of people say, oh, well, like in preparation for your cancer treatment, you need to go eat a whole bunch and gain weight, because you're likely going to lose weight with the nausea and the effects that come from that. So in the cancer centers, they've got donuts and cookies and sodas and all this sugar that's basically feeding the cancer cells, right? And so there's still just this huge miscommunication there of like, what are we actually doing? And we get patients come to us, can you help me with this? Can you help me with that? And we do not treat cancer, although there are integrative doctors that are doing that. And I think that's a great thing. It's just not where I have chosen to really go and get my expertise, but I like knowing that they're there and I can refer people there. But really what our approach is to say, how can we get your own body to do its job the way that it's supposed to? Why did this cancer get here in the first place? Yes, we may need to knock it out, and we can do some, traditional medical type stuff, but what can we do in the meantime that's going to help support all of these nutritional deficiencies, the inflammation that's coming through, the issues, that we'll see from that. So we see a lot of depletion of nutrients. There's a lot, it depends on what study you read, right? But you can do high dose vitamin C treatments and glutathione and, alpha lipoic acid and all these things that can help boost your own body's immune system. And then we go really back to basics of just, what are you eating? What are we putting in our body? And are we giving our body fuel that's going to help support it? Or are we continuing to give our body poison that's going to cause more stress? So if we really go to that, how are we managing, what you're putting in your body? Not only food, but then what are we letting in from a stress perspective? Are we moving our bodies? And it doesn't mean, if you don't feel good, obviously you're not going to be running marathons or anything like that, but moving is what gets rid of toxins, right? So and it's good for your brain, and helps you sort of have the right attitude. So I mean, there's just, we can go layer and layer and layer about all of these issues. But it may be that somebody is going through chemo or whatever that is, but we can come in and look at it from that perspective of, how can we support this body while it's having to go through this treatment? And I think that's what's missing in the traditional approach, for sure. And I mean, you can comment on that way more than me, but um, that's what I see.
You just literally nailed
Yeah,
everything I have wrong with me now.
yeah,
I've lost 6 inches of my colon. I have so much inflammation.
yeah.
Uh, I'm not getting the nutrients. You basically hit everything. My gut health is ridiculous. Yeah. Um, so getting away from me and the cancer part of it though, what do you see mostly in your practice right now? Is it people that are, because we're not eating right, having to come to you because of all the effects from that?
Probably a combination of a lot of that. I mean, I would say nutrition and gut health is where we start, and we do testing on people for their gut even if they don't come in with gut symptoms, right? Because I think, our whole intestinal tract from our mouth all the way down is like our second skin. It's just skin on on the inside, and we don't quite recognize that. And so you can't really see it or you can't feel it until it gets really bad. So exposure and that skin, thickness and the defense of the skin layer, and I'm talking about the inside skin if you think about it that way, really gets damaged. And so toxic exposure to our foods, to the environment, we get what we call dysbiosis. So it's like we don't have enough good bugs, good bacteria, and we get things that shouldn't be there. We can get yeast overgrowth, and we can get more toxin exposure and that sort of thing. So we really need to look at, I think if we could microscopically see it, it would look like somebody who was walking around with a rash all the time, right? It would be really inflamed and red. And we don't quite, you can't visibly see that. And so, and sometimes you can't really feel it. So to me, that's where we start is what is our body being exposed to? What's out of balance there? How can we manage and treat that? So when patients come to us, I would say, we probably do a lot of hormones, and that's why people, most women, I would say our main patient is a female between the ages of 40 and 60. So they're kind of coming for hormone related things. But also along with that, it's like, well, what does that mean? It's like, well, as I'm aging, I just don't feel myself. I'm more tired. I'm not getting the best sleep. I've got a lot of stress in my life. I just don't feel like me. Weight issues are huge, just can't seem to lose the weight. And even though I'm trying, um, so, we do see some gut symptoms for sure, but I would say that's lower on the list. Fatigue is probably number one. That just, I'm too tired to do the things I love to do or what I used to do. I just want to be myself again. Those are all these words that we hear, from our patients. And it may be, we'll get somebody who's going through cancer treatment, or they have a history of that they've overcome, which is fantastic. But then they kind of have this fear, like, I don't want to do, anything that may increase my risk for that. And I'm over here going, everything we do is going to decrease your risk, right? So, not only are we going to help you feel better and get your life back, but, reduce that risk of recurrence is huge.
So
So those are,
dealing with a big trust issue too.
yeah, yeah, absolutely. And, I think it's expensive, but our testing is getting better and better. So there's ways that we can test a little bit more, see a little bit more markers that can give us some reassurance. It's not just let's look at inflammatory markers or a CBC or something like that. Like we're able to get a little bit deeper, not only in the genetics, but also um, breast cancer specifically, which we see a lot of women. So that's kind of where our history is. Um, there's some pretty cool testing out there where they can actually test the tumor, and then they know what those markers look like. So like you can serially have those tests done to see whether those are in your blood. And that, I think is huge in terms of being able to sort of screen, ahead of time before a new mass shows up, or, some symptom. By that point, this has become much more aggressive than it's able to that we're able to attack, right? So I think that there's definitely technology that's allowing us to look at that. But again, how do we prevent that from happening in the first place? If we are dealing with somebody with a history of breast cancer, again, I'm going to look at why did that happen in the first place? What was out of balance that led to that process of inflammation? And what we know now about hormones, really in the last probably 3 to 4 years, there's been some tremendous studies that come out that are actually showing, worsening cancer with hormone depletion. And so, what happens at age 50, and it's like, oh, we got to start screening for all these things at age 50. And it's like, did we just hit a cutoff of an age that, we age out of healthy, versus, well, what happened at age 50? All of our hormones went away for both women and men. And so not putting two and two together to recognize that hormones actually are healthy. And, if hormones were that bad, then, if testosterone caused prostate cancer in men, then all 18-year-old boys would have have cancer. And same thing, if hormones were bad, women go through, crazy fluctuations in pregnancy and things like that. And so pregnancy actually decreases your risk of cancer. And that's a huge influx in hormones. And so I think it's just this misnomer that it's the type of hormone replacement. If you're getting something that wasn't meant to be in your body and you're swallowing it, that's really, it becomes a foreign substance, another toxin, if you want to think about it that way. And so the studies that were done were on Premarin and Prempro, which were pregnant mare's urine, so not human hormones, but horse hormones that we were then swallowing. So it's going through our liver, and our body goes, we don't know what to do with this, so we're going to package it up and make it something that seems a little bit safer. And that's where the risk of hormone replacement in breast cancer came from. um, there's just so many variables that go into that misinformation that has really uh, been figured out in the last several years to be the opposite of what we know.
It's funny you said. I kind of laughed a little bit when you started talking about hormones because, again, it's natural. It's like we just completely forgot about natural in general. And we jumped into, okay, just something that's completely opposite. And now we're starting to come back. Okay, these are what's natural in our bodies that we need. But you also brought up something interesting to me. 40 to 60-year-olds female are kind of your niche right now as far
Right.
as who's coming to you. 40 is young, is it not? I mean, are you seeing younger and younger? And you say, we're going to check at 50. Is uh, does that worry you that it's too late?
Well, I would say they're coming to us at 40 with symptoms, and not cancer symptoms necessarily, but they're hormone related symptoms. And this is one of my favorite things to talk about, is kind of why are we seeing this, right? So, I think I can go off on multiple tangents. So I have, one thing to say, kind of going backwards a little bit, is like, if we think about nature and we think about where we were and we've sort of evolved, is that, caveman days, it was like we were born, we procreated, and we died around 40s. So, we didn't know what menopause was like back then. And because of our brains and science and whatever, we figured out how to live a whole lot longer. So, almost half of our lives are lived in this lack of hormone state. And that's really where a lot of disease processes are we're finding. And that's also, more exposure to all these things that can damage our cells and that sort of thing. So what I find really interesting is that we can get really fancy with this, but I do a lot of work on adrenals, and your adrenal glands make cortisol, which is your stress hormone. And again, kind of caveman days, they might have had some stressors, with some famine or being chased by a saber-toothed tiger or something like that. But they didn't have like this constant sort of stimulation of life coming at you, and these kind of daily stressors. And so what we're finding is that initially our bodies are keeping up and kicking out more and more cortisol to help us deal with that. And then at some point in time, the adrenals go, I wasn't made to do this. And so they get fatigued, and we actually see lower responses to stress, which causes the fatigue and sort of some anxiety and things like that. But where this connection is, it'll make sense in a second, is that progesterone, which is a female sort of procreative hormone. If you think about it, that's what's kind of stimulating our uterine lining to be prepared for a pregnancy, that sort of thing, is directly related to cortisol. And so as cortisol goes down, what happens is that staying alive is more important than having more babies. And so we're going to basically sacrifice progesterone to keep cortisol stable. So we're seeing these hormone changes in women due to low progesterone because of the adrenal dysfunction that we're finding, earlier and earlier. I mean, we're seeing, when I first started 20 years ago, it was like, don't even bother testing cortisol in a 20-year-old, they're going to be fine. And now, because of just, again, I think it's exposure, it's the chemicals in our world, in our environment, the stress that we're dealing with. Let's not even get into social media and screen time and all that kind of stuff, but we could, right? So
Right.
all these things are sort of progressively making our hormones change earlier and earlier. So they may present with hormones, and if they went to a GYN in traditional medicine, usually they just get put on birth control pills to help regulate their cycles or regulate their hormones or whatever, not really looking at why. Why are my hormones out of balance? What is this about? And so in the 40s, 40s to 50s, we call this kind of perimenopause, right? Why I'm too young to be menopause. Why is this happening? And so, as those hormones go away, progesterone is very calming. It helps us manage stress a little bit better. So we're getting, counter attacks basically with more stress and then less hormone that helps us manage that stress. Also, progesterone is protective to the breast tissue. So if we're getting less progesterone and more stress and more inflammation, then our risk of breast cancer is going to go up from that perspective. So, it's a little bit tricky when you get to screening, and then screening is just a whole nother thing in and of itself. Like if we're talking breast cancer screening, that mammograms are the standard, and then, we're just radiating this breast tissue that is already sort of um, fragile, if you want to think about it that way. And so, there's a lot of argument about what's the best way for us to be screening and what is that age. So, somebody picked 50 as the age to start getting mammograms. And although I think there's some conversations now that we should start earlier, but I'm just thinking about all the screenings that have, when you turn 50, you need a prostate exam. When you turn 50, you need a colonoscopy now. You turn 50 and you get mammograms in women. And so it's just this idea of this 50 that turns into the time frame where you need to start screening. And, screening is really just early detection of disease. When we're talking about prevention, like let's really start way early, let's start as kids to say, what is it that's going to cause my body to be out of whack? That's going to lead to something like this inflammatory state that could lead to cancer, right?
Trying to get them to listen to that though.
Oh,
There's 5
that's okay.
kids
I
and
have
yeah.
4 and, teenagers and like yeah.
Yeah. I mean, my 6-year-old is probably my best, and he's like, "Dad, there's too much sugar in that." But the rest of them are like,
Yeah.
"Yeah, they'll figure it out
They'll
when it's
believe it
too
until
late,
they start
unfortunately."
until they
Yeah,
start driving and they can access it themselves, and then it's
exactly.
painful.
Exactly. Before we go out, what would you tell somebody, female that's in her 40s and 50s, that is not feeling good? Where do you start?
Yeah. I think lots of places. One, I hope that they can listen to something like this and start hearing the language so that they're looking for some support out there that is not, just put me on birth control pills or an antidepressant. Like that's usually the two things. If they go to their doctor and say, I don't feel right, they get their labs checked, and basically their labs are normal because they're not checking the right labs. So, their thyroid's okay, their CBC's normal, their cholesterol's fine. So, they'll get put on birth control or they'll get put on, some antidepressant to say, well, it must be, let's just settle your brain, right? So one, I would say there are people out there that know and speak this language and can help, number one. But even at home, just what I was talking about is like, are we paying attention? You can start with looking at your food. Is this food going to be fuel for your body, or is your body going to have to do some work in order to take care of it, right? So that's step number one. And then step number two is do the best that you can to manage your stress, get better sleep, get outside, move, and I'm not saying, we need to exercise X amount of minutes a day or whatever, is just move more. I think our sedentary lifestyle, I used to ride my bike everywhere when I grew up in Boulder, and like we live even in a small town, we see some bikers, but like there's nowhere for them to go. So, we get in the car and we drive everywhere. And so we purposely have to move, not to transport ourselves, but just find exercise, so depending on where you live, obviously that could be a little bit easier to transport yourself, but we just don't find the time to do that as well as we could. So, and a lot of people will say, okay, check the box. I exercised today for 45 minutes or an hour, and then they go sit all day. And so, this sedentary lifestyle. So if you could do 3 things, is pay attention to your food and what you're putting in your body, try to reduce your stress, get better sleep, and move your body, then you're going to be way ahead of the game.
And trust yourself. Yeah. When something doesn't feel right, it's probably not right. I'm horrible with that, but yeah.
Well, that's why, it feels good in your brain in the beginning. Ooh, I'm craving this. I want to eat this. And then, your body tells you immediately afterwards and you don't feel good, right? Maybe
That's
I shouldn't
very
have done
true.
that, and then,
Especially when you have
may
no
or
more
may not
lining
learn
left,
from that.
it definitely doesn't feel good. Oh, Dr. Aimee Duffy. I mean, real pleasure. And I'm going to post everything on my blog that goes along with this, as far as your website and your books and everything you've done. I really appreciate it, and I hope we can have you on again.
Sounds awesome. Thank you so much.
Oh, thank you. All right, everybody. Thank you for watching. As you know, find the attitude, keep the attitude, go out living. Bye.